Assalamualaikum everyone. I hope all of you are doing well. In this video I am going to talk about an solitary pulmonary nodule. So solitary mean single, pulmonary mean lung, and nodule mean growth. So single lung nodule. When a patient has come to you to the OPD or to the emergency with chest complaint, for example, a chest complaint may be coughing, it may be dyspnea, it may be any other complaint of chest, it may be chest pain, and you do the X-ray, but on the X-ray you find a nodule in the chest. Then a suspicion is arise whether this nodule is malignant or benign. But before discussing this point whether the nodule is malignant or benign, you should to keep the differential in mind. The nodule may be infectious granuloma, it may be bronchogenic carcinoma, this nodule may be due to hematoma, and this nodule may be due to bronchial adenoma. Any of these can be there in the chest. So there are some points whether the nodule is benign or malignant. The first thing that you should keep in mind is the age of patient. You look to the age of patient. If the age of patient is less than 60 years, then most likely the nodule is benign. And if the age of patient is more than 60, then most likely the nodule is malignant. When the age of patient is more than 60, 50% chances of malignancy is there. Then ask about the smoking history. If the patient is not smoking, then most likely the nodule is benign, because most of the malignancy of the lung are associated with cancer except the adenocarcinoma. So if the patient is smoking, then most likely the nodule is malignant. Third point is size of nodule. If the nodule is less than 1 centimeter on X-ray, then most likely the nodule is benign. And if the nodule is greater than 2 centimeter, then most likely the nodule is malignant. The fourth is the borders of the nodules. If the borders are regular, then most likely the nodule is benign. And if the borders are irregular, then most likely the nodule is malignant. And the fifth point is the calcification. If there are calcification, but the calcification is dense and it is central, but the calcification is dense, for example, this is the nodule and the calcification is dense and it is in the center, then most likely the nodule is benign. And if the calcification is eccentric and asymmetric, for example, this is the nodule and the calcification is here, then most likely it is the malignant nodule. The sixth point, nodule is benign or malignant, is the change in size. If the nodule is not changing in size, then most likely the nodule is benign. And if the nodule is changing in size, then most likely the nodule is malignant. But you did only one X-ray, but how can you know that the nodule is changing in size? For this you have to always ask from the patient that whether he have previous X-ray or not. If he have previous X-ray and he have also nodule on the previous X-ray, then compare this new X-ray with the previous X-ray. If the nodule is enlarged in size, then most likely it is malignant. If the nodule didn't change in size, it means the nodule is benign. So on these differentiating point between the benign or malignant, you come to the conclusion that whether the patient have high probability of malignancy, intermediate probability of malignancy, or low probability of malignancy. If the patient have low probability of malignancy, then keep the patient on serial CT scan. And if there is intermediate probability of the malignancy, then do the positron emission therapy, and if it is positive, then do the biopsy, and the biopsy will confirm whether the nodule is malignant or it is benign. And if there is a high probability, for example, these all risk factors are there in the patient, for example, the age is greater than 60, if the patient is smoking, and the nodule is greater than 2 centimeter, and the border of the nodule is irregular, and the calcification is eccentric and asymmetric, and the nodule is changing in size, then the probability of malignancy is very, very high, because the risk factors are there. So biopsy, then do the biopsy. There are three methods for taking the biopsy. One is the transthoracic, the other is bronchial, and the other is video assisted. So you can take the biopsy of the patient if the malignant suspicion is very high. So this was all about on solitary pulmonary nodule. For more video, subscribe, like and share. So thanks for watching the video.